Good evening, ladies and gentlemen. Welcome to Reference Point. I'm your host, Dave Coker-Hook. This evening, we're going to be talking with Sally Adelus, who is the president and CEO of Hospice of the Valley. I don't know how much you folks know about the Hospice Network and the work that they do. It was something rather unfamiliar to me until recently when I had a personal scenario in my life that we needed to utilize their services. So I'm very excited to have Sally here with us today. And Sally, thank you for coming and joining me this evening on Reference Point. I'm really looking forward to this conversation.
Well, thank you, Dave, for inviting me. It's a pleasure to be here.
So I understand that November is National Hospice Month. Is that correct?
It is indeed.
So what exactly, does that mean, National Hospice Month? I wanted to learn a little bit more about the fundamentals and what is the hospice organization like here in the United States and where is it going to go?
Well, it's wonderful that we're honoring Hospice Month in November because it's a chance for all of us to sort of think about hospice. It's a subject that a lot of people find taboo and just don't want to even think about or even think it'll come into their consciousness. Mm-hmm. So it's a chance for us to really ponder on what hospice means. Hospice in the United States has really grown significantly probably over the last 10 years. Currently there's over 5,000 hospices across this nation.
5,000, mm-hmm. That's pretty good.
Yes.
And growing.
And growing from where we came from many, many years ago. And I don't know how much you know about where we started from all those years ago.
Nothing.
Okay, well, if I can go way back yonder, the word hospice actually comes from the linguistic root of hospitality. So it circles back to medieval times. And really, it was a place for weary and sick travelers to find refuge, if you will, respite along the journey. So it's a very symbolic connection to hospice itself, thinking that at the end of life, we're all on a journey, so to speak.
That's true.
And so it came from those times, and it wasn't until it came into Europe with the work of Dame Cecily Saunders, a very fine woman indeed, that brought the true concept of hospice to its fruition.
And that was in England?
That was in England, at St. Christopher's Hospice in London, yes.
And so the movement, if you want to call it that, initiated there with the idea of doing what? I mean, what makes the hospice environment, the activities, unique and different from what you would expect if you're sick and you're dying and you go to a hospital or you go to what's the difference?
Different? What is unique about hospice?
Yes.
It's really a concept, a philosophy of caring for somebody at the end of life. And it's not just the individual. Hospice is around caring for not only the individual but the family and the loved ones. So it's very different type of care than if you were going into hospital or for some surgery or some rehabilitative focus in your care. Mm-hmm. And we look at the entire person, if you will. If you were faced with advanced disease, you wouldn't want, for me as a medical practitioner, to just focus on your physical needs. You have many dimensions, facets, if you will, of dealing with that disease, be it emotional, spiritual, social, physical, your fears around what's going to happen. So hospice is about caring for the whole person. We talk about it being a holistic approach to care, and that's what it truly is. It's really family-centric care. And I think one of the unique things about hospice is that it's about the individual's or the person's goals at the end of life. So we come in at a time when perhaps, most definitely, that person has decided no more treatment, is not focused on curative treatment. We step in at a point in time when curative treatment is no longer an option. And
so how does that decision get made? I mean, I can kind of see the concept, and we went through some of this with my mother recently. But it's like the idea of reaching a point where you say, this is not a viable option for me to go through whatever the procedures are to try to cure this illness that I have, but I'm looking at how do I enjoy what time I have left in a manner that somehow enhances whatever, I don't know what you want to call it, quality of life that I may have left. So how
do you begin that conversation?
Where does that start?
Well, it often can start with the patient and the family starting to ask some questions. When you're progressing through a very, perhaps an aggressive type of treatment, and you start to look at what are the benefits and what are the risks.
Mm-hmm.
And there's somewhere along that line, it may have been, I'm not sure of your experience for your dear mother, but somewhere along that line, it may have been her or the family member that may have asked that question. It may not necessarily just be about prolonging life.
Mm-hmm.
The focus starts to shift on the time we have remaining, the quality of life.
So how does hospice interact with traditional medicine and the doctors who have been treating a condition, and then you reach this point where you look at it and you say, you know, it's like, you know, I have an auto mechanic who tells me, look, Dave, I can fix your car, but it's going to cost you more than the car's worth, so you probably better go get a new one. And that's happened to me a couple of times. I mean, that's maybe a crazy analogy, but it's somewhat similar, I guess, in the sense that if you're going through whatever a process is, an illness that's progressed to the point where there really isn't an option for total cure, where does that conversation get initiated? How does hospice interact with traditional medicine to kind of make that transition?
Well, I think one of the most valuable times for that conversation to start to happen before hospice gets involved is for that individual and the family to start asking those questions from perhaps the physician or the medical provider. Mm-hmm. And it can be the physician herself or himself that would start to promote opening that conversation. These are really difficult discussions to have. They're not easy.
Sure.
They really are not easy. It takes a lot of skill from the medical provider, the physician, and it also requires the patient or the individual and family to be open to have those discussions. Mm-hmm. You know, when we all start to talk about, have I made my advanced healthcare directive for my family to let them know my wishes when my life is coming to a close? Mm-hmm. Most of us will say, no, we've never had those discussions. We'll think about having those discussions much later in life.
We almost never think about those things. I mean, that's one of those areas that is, for whatever reason, we don't like to think about. We don't want to confront. Years and years ago, I was in the life insurance industry, and it was one of those things where you're sitting and you're talking to people about, you know, putting something in place for their future and the future of their loved ones, and you just don't want to hear it. You don't want to talk about it.
And the sad reality is most of those decisions in our lifetime are made in a crisis situation.
Right.
You know, it's either where our loved one has been admitted into the intensive care unit, and there's a rapid evolution of events that are occurring, and the family are in a crisis, and they're saying, well, what would Mum have wanted?
Right.
And I can remember way back when we were sitting down having Thanksgiving dinner, Mum talked about not wanting this towards the end of life. Mm-hmm. So those discussions, the more we can have those discussions earlier on, it's so critically important, because what we see in hospice is that families come to us without ever having had that discussion.
Is that a cultural thing?
It can be very much an individual cultural thing, absolutely. You know, our values, our beliefs, our socialization. I mean, from myself, you can probably tell I have a little accent, and I come from the UK, and it's a little taboo to talk about these things, you know, have these difficult conversations.
So when did hospice first start in the United States?
You know, it first started, if you look back years of when the movement started to happen in the UK back in the late 60s, it started, the waves started to come across, and the discussion about hospice started to hit the United States around just a little after that. People of 70s, 80s, there was this movement, there was this acknowledgement that caring for individuals and families at the end of life needed a different type of care, different type of care, yeah.
And it's grown to the point where there's 5,000 hospice organizations
Yes.
in the United States.
Yes.
So obviously there's some inroads that have been made.
Absolutely.
But I'm guessing there's still a long way to go.
There's still a long way to go. There's still a long way to go. I mean, we've had definitely increased awareness. We still have a lot of stigma, misconceptions about hospice.
Let's talk about that. What you and I had a conversation a couple of days ago before you came on the show about some of the whatever you want to call them, the myths, the misunderstandings about the hospice. And I'd like to talk about those a little bit. I think it would be interesting to the viewers, hopefully, because it's, when we talked about it, it were things that resonated with me in the time when I had to initially go through the process. So, so what are the main stumbling blocks?
I would say one of the main stumbling blocks is the belief that coming onto a hospice program, a hospice service, means giving up. You know, if I sign on that piece of paper there, it means that there's no hope left. And in hospice, we look at that as redefining hope. I mentioned about goals, patients' and families' goals towards the end of life. So if you can think about it in this context, if you have, there is perhaps no hope for a cure for your disease. However, there could be hope still surrounding yourself, your being, your family, with in the context of perhaps today, you know, I could hope to go to the ocean one more time with my family. Perhaps today I can hope to connect to my brother that I haven't spoken to for the last year. So I would say that we're really in the business of helping individuals, patients and families redefine hope. And you and I know that when we have hope in our lives, we have a very different outlook on life.
Yes, yeah, absolutely.
So it's all about goals and setting our goals and what's important to us at the end of life, towards the end of our life.
And it sounds like part of it too has to do with a sense of understanding what the circumstances and the conditions are. That doesn't mean that you are giving in to whatever, you're giving up the fight, but you're recognizing that what the realities are, and there can still be hope within that context.
Absolutely,
okay.
absolutely.
So that's one of them, the idea that if you agree to initiate with hospice, that you're saying, forget about it, isn't nothing, it's I'm at the end, and that's not necessarily the case.
Not necessarily the case.
Okay.
For many, they associate hospice with, well, perhaps I'm going to die sooner this way. If I sign up for hospice, perhaps I'm going to die sooner.
You mean if I do this, I'm sort of accelerating the
process.
That's a strange one.
It is a strange one, and the sad reality is about that. Many of individuals that come to hospice come to us far too late, meaning we can serve those individuals for 6 months, to the last 6 months of their life, and they come to us typically in the last few weeks of life. So there's been this awareness that hospice is just for you just at the very close of life.
Right at the bitter end, yeah.
So the association is there that, well, I remember my neighbor or, you know, a friend's loved one, they came to hospice and then they died. But it's because they don't come to hospice early enough.
Right.
So there is this association with the two. But that's a real fear. That it's, again, it goes back to giving up.
Right.
I'm relinquishing everything here if I sign up for hospice.
Okay.
And I think one of the beauties of hospice is we all have a choice, and people don't realize that once you come onto a hospice program, you can come off. If it doesn't feel right,
right, that was an interesting thing that I learned.
You can decide to come off hospice.
Right,
yeah.
And it may be that your condition improves to the point where it is the services are not needed as desperately. And so for a period of time you can be off, and then you can come on, which is very cool. All right, so we've got 2 of them. Are there any others that are the big stumbling blocks for people?
You know, I don't like to say this one, but I will. I'll be totally honest. And there is an association that when perhaps your loved one comes onto hospice where you're going to start some powerful pain medication. And that's, the person may die quicker. Going back to where individuals come to us in the last few weeks of life, it's very obvious at that point in time their disease is very, very advanced.
Right.
They're very close to the end of their life.
Right.
And sometimes in some individuals they do need the right type of pain medicine to control what could be at times very severe pain.
Sure.
But again, there is that misconception that hospice coming so late, coupled with a strong pain medicine, that the two go hand in hand, not necessarily
we experienced that to a certain degree with my mother's situation as it got closer to the end, and we could tell that, that that the need was there for something more to allow her to be more comfortable. So what I'm hearing out of this, Sally, is that for the most part, it's that people wait too late to engage. So when is the right time, or is there a prescribed point or something like that when you can say it makes sense to find a hospice service in my community?
I'd like to go back to coming too late. One of the things that we find on our family satisfaction surveys, one of the most profound comments that we get from families after we've been involved in their loved one's care is, "I wish I could have known about hospice sooner." So this is coming from the families that we serve. So it is indicative that people say as soon as hospice becomes involved, there is this beautiful concept of caring that envelopes not only their loved one but the whole family, and they're going, it made a difference. And I don't know about
I can speak from personal experience to that. It was an unexpected what's the right term for it here? But it was a sense of relief as someone who has no medical experience. My wife's an RN, but so she understood stuff. She's trying to explain things, and here's what's going to happen. It's like, okay, we're not getting it, but there's a certain, all of this pressure and frustration and concern and whatever, and having someone, and it's a team really. It wasn't just one person. There was a team of people who were able to relieve some of the physical burden of activity off of myself and my wife and my sister and her husband during this process, which was amazing, totally unexpected to me. I had no idea that was going to be the way it worked out, but it was really very, very good. So going back to the question of where on the timeline does it make sense to begin to initiate, and is there a right or a wrong time to engage with hospice?
I think asking the questions, certainly from your medical provider, once treatment starts to become less of an option, is the time to start to have those discussions about hospice. I think that's one critical point. Families often don't realize that they can actually initiate a referral to hospice. Now, the physician obviously has to qualify that this patient does in fact meet the eligibility criteria to admission to a hospice program. And what that typically means is that the patient, if continues on this normal course of expected disease advancement, would have a life expectancy of 6 months or less.
Okay.
And decide not to engage in further curative treatment. So those are the two main criteria, eligibility criteria warranted to entry into a hospice program. But at any point in time, the family, the individual can start asking those questions about, is this a program that I should be considering? Is this something in the spectrum of my care that again, it's about choice towards the end of life. I think you hit on two key words, though, if I can reflect back a little bit of what you said there about team approach. That's what's unique about hospice.
There's something I want to dig into that a little bit more deeply, but I want to make a comment to the viewing audience. I want to tell them a couple of things. First is that I think that the subject matter that we're discussing is deeper and broader than one episode of Reference Point is going to be able to manage. So I have asked Sally to come back again for the next show and to dig into this a little more deeply. And the other thing that I want to mention is that if you can have questions about this type of an action, about hospice, about anything you want to try to communicate, you can see that we've got some information about Hospice of the Valley on coming up on the screen there, but you can send an email to me at info@referencepointtv.com, and I'll make sure it gets sent to the right parties and we can get your questions answered. So let's go back to what you were just talking about, the team approach, because this is very interesting. I want to learn more about this in general, but soon we're going to start digging into some of the specifics of some of the fantastic programs that you guys do here. And I think it's real interesting that the hospice concept is there's a lot of similarities when you go from location to location, but there are some unique things for each hospice organization as well. But let's talk about the teamwork approach.
Teamwork approach, and this is very unique to hospice. We really symbolize the team approach. And what does that mean? Not excluding the individual and the family. If you can think about the person with this advancing disease at the end of life, and you can think of their family, their loving caregivers, surrounding them is this team that is all focused on the patient's goals and what is important to them towards the end of their life. That is really the guiding light for a hospice team. The members of the team can include the hospice physician, a registered nurse, a nurse case manager, a chaplain. Again, remember the realms that I talked about?
Right.
Spiritual, medical, physical, symptom management, a social worker, again, a hospice aide to help with bathing. You talked about the burdens of caregiving, and I'm not going to say that I understand that, but one of the areas that needs to be focused on for all families is the burden of caregiving is enormous, absolutely enormous. It can be exhausting. So to have somebody like one of our hospice aides to come in and help with just the practicalities of bathing.
You know, so one of the things I want to comment about on that is that as a family that was caring for or wanting to do whatever we could for my mom, who was going through this process, being able to offload that kind of activity to someone from hospice made it possible for us to be together more as just a family, but also to spend time with her in a more personal manner. So to just.
And how good did it feel for Mom to have her needs met, her personal care needs, and for you as a family member?
By someone who was not the son or the daughter or the brother, son-in-law or daughter-in-law. I mean, that was huge. I mean, you could see it just in her eyes that it made a big difference that there was someone else that she could go to for that, and she didn't have to burden, quote unquote, her children with that.
Absolutely.
I mean, it was huge. I don't think that the reality of this sort of release or opportunity to relieve the family is something that people think about. I think we tend in our culture here to think, I need to, it's my job, my duty to find a way to take care of. And I think maybe it's find a way is the right words, and it can be through hospice as opposed to having to figure out how to do it myself.
And struggle through that process.
Struggle through it,
The other important team member, the integral team member, is a volunteer. And a volunteer can be there for just respite, to allow the caregiver to have a break, just a very much needed break. Can also be there just for companionship, to sit down and for that person with that nearing the end of life, to share stories, to talk about what's going on, to really involve the family. The volunteer is an integral member of the team. One thing that I would like to share, though, is that all of this hospice services, team services, are all intermittent. So we don't replace the caregiver. I think of hospice as a facilitator, a guide, if you will. And you talked a little bit about that, about how it can be pretty scary going down that road of knowing not what do we expect is going to happen with Mom. But so if you think of hospice as the guide coming in there, and whether it be a physician's visit at home or a nursing visit, and then the other important part of that is that those services are available 24/7.
Sure.
So
you can come whenever you need them.
For your mom, being able to call the hospice in the middle of the night in the dark wee hours at 3 o'clock in the morning, and if Mum was in pain or short of breath, well, what do we do? Being able to contact, an experienced professional over the phone at that point in time is really important.
Sure, and we actually made some use of that ourselves. And this was up in the Pacific Northwest where my mom was.
Yeah.
Hospice services to the family and the patient, my understanding, is for the most part, I guess maybe it depends on the age of the but the services are free to the family, or to a certain degree. Is that correct?
Well, we are mandated under the. Let me backtrack a little bit. Hospice is reimbursed under certain insurances. Of course, if you're a Medicare beneficiary, you're over the age of 65, there is a unique program called the Hospice Medicare Benefit that has, if you will, those eligibility criteria I talked about.
Right.
Obviously, they come under the guidelines for entry into a hospice program. So if we take Hospice of the Valley, our program, close to around 80-85% of our patients are Medicare patients.
Makes sense. Yeah.
However, and Medicare reimburses us for a fixed amount per day for taking care of that patient. In addition to that, most private insurances follow the similar model as the Medicare hospice benefit. So, and they're typically the same sort of reimbursement for the hospice program.
Right.
And then, of course, we are a non-profit. If there are some patients that have no insurance at all, we would accept those patients onto service. Again, going back to those eligibility criteria, we all follow those same. All hospices, whether in our county or across the nation, follow the same criteria.
So for the most part, the services that are received by the patient and the family are going to be able to be covered by either the Medicare program or private insurance programs, or possibly as just
Medi-Cal
or whatever. And there may be some things that come out of pocket, but they're going to be nominal.
Yes.
I think when it came down to for everything on my mom's side, it was just like, it was almost nothing, which was really wonderful. We only have a little over a minute left in this episode here at the show. So what I want to do is remind the folks that we're going to be continuing this conversation into the next show and talking more about some of the specific programs about hospice. Really wanted this first conversation to try to give people a sense of there is programs out there. There are things that can be done, and it's not a scary thing. You should actually engage with it as soon as you can. So in the last minute that we have here, Sally, of this show, what would you like to say to kind of wrap up the thoughts that we've had so far?
I would say ask the questions and begin the conversations. That is the most important message I would impart to your audience.
Good.
Yeah.
Begin
and don't
the
be
conversations
frightened.
and ask the questions. And I think that's really key. I mean, it's never a bad question. Even if it's not appropriate at this time, you'll find that out.
Absolutely.
So folks, I want you to come back to the next episode of Reference Point, and we'll pick up where we've left off. And don't forget to send in your questions to info@referencepointtv.com, and we'll see you next time.
Thank you.
Pretty good.
Okay.